Another common question before LASIK that has been asked is whether dry eye is permanent after LASIK. Generally, no. It's most commonly dry eye lasts for a few months after LASIK because there is some amount of time that the corneal nerves take to regenerate after that. It can go on for a few months, but that is more common when there is some amount of pre-existing dry eye, and therefore it's very important to treat that before we go ahead with the surgery. And very, very rarely it is chronic and then needs further evaluation and treatment for other systemic conditions like I had mentioned earlier. Another common complaint is that vision is blurred after LASIK or refractive surgery. So blurry vision, as we have shown in previous slides, because of scatter and because of loss of contrast, can happen after surgery because of dry eye. Dry spots on the cornea can cause scattering of light, and this can cause some amount of fluctuation in the quality and quantity of vision initially. Typically, what patients post-LASIK do complain of is that in the morning, the vision is a little blurry, and as the day progresses, it tends to get a little bit clearer. So that may be because of some amount of dry eye overnight. Sometimes people sleep with their lids slightly open. That can exacerbate the dry eye. So as soon as the lubricant is put in the morning, generally the quality and quantity of vision improves. The caveat is that if there's very blurred vision after a few months of LASIK, it is important to get it checked by a surgeon, as it may not always be because of dry eye, and there are other conditions that can also cause blurry vision, and therefore at that stage it's important to kind of get it checked out. Very commonly after cataract surgery, patients ask, did something go wrong in the surgery when they have this kind of irritation in the eye? Generally, the answer to that is if the vision is good after cataract surgery, it means the surgery has been successful. Symptoms like heaviness, tiredness in the eyes, and irritation are generally symptoms of dry eye. However, this does not mean that something has gone wrong in the surgery. And generally, the thing to remember is that the dry eye becomes worse after surgery. So that is something to just be aware of, give it a little time to actually heal. The other thing that is in vogue these days is laser cataract surgery. And very often patients ask, does the laser cause less dry eye? So femto laser cataract surgery is in this femto laser, which is similar to the laser in LASIK, creates the incision into the cornea and it creates the opening into the lens capsule and it fragments the cataract. So this creates an incision which is about the same size as the normal incision through a microincision cataract surgery. So there is not much difference in terms of the amount of dry eye between this type of cataract surgery and standard phacoemulsification surgery, according to most publications. So doing a laser does not necessarily mean that you would not have dry eye post cataract surgery.